Hi, everyone. It's Deanna once again. I am one of the directors at Premier Behavioral Health Services. And today we're going to be speaking with a different provider. Perhaps you may know him, or if you do not, today we'll be speaking with Dr. Tony McMahon on how during the COVID-19 pandemic, how anxiety can be your friend. Hi, Dr. McMahon. How are you?
Good. How are you?
Good. Hanging in there.
So I'm Diana. You were just saying I'm Dr. Tony McMahon. I'm a licensed clinical psychologist here at Premier. What I want to talk about today is anxiety in the era of COVID-19. Uh, it's understandable that everybody's anxiety is probably at least a little bit heightened right now. And I think a misconception about anxiety is whenever it pops up, it's a bad thing. And I think it's important to remember that we have anxiety for a reason. Anxiety is actually there to keep us safe. Those of you who've worked with me know that sometimes I'm prone to say that anxiety is your friend. But like any friend, it can overstay its welcome. And right now, it should be viewed as a welcomed friend as long as it's in the right dose. So when we're talking about anxiety today and what's going on in the world, I think it's important that we keep it at least a little bit close, because keeping that anxiety close is going to allow us to maintain all of the recommendations that are being given to us by medical professionals. Things like wash your hands, don't touch your face, social distancing, things that I'm sure all of us are pretty aware of now, given how COVID-19 is talked about just about everywhere. But at the same time, it's important that anxiety doesn't overstay its welcome. By no means am I advocating an anxiety disorder or a panic attack. And for that reason, if you do need help, if you feel like your anxiety is disproportionate to what's going on, and if it's really affecting your day-to-day life, it's important that you know that there are services still available. Premier has now transitioned care to telehealth services. There's other providers as well too. And whether it's individual sessions or more intense treatment like group work, there are providers out there who can help you in this difficult time.
Excellent. Thank you so very much. We really appreciate it. And thank you everyone for tuning in. And we will continue on with our series with several different providers. So please send us any questions that you might have, and we will do our best to answer them during this time. Thank you very much, Dr. McMahon. Have a nice rest of your day.
Thank you. Take care. Stay safe.
All right, you too.